Welcome back to Ned Conger on YouTube. Today I'd like to talk to you about my plan for healthcare, a savings plan where everyone in the United States, whenever they bought anything, they would pay a 10% tax that would go immediately into their health savings plan. And whenever they're sick, they would just go to the doctor. The doctor would assess his bill to that plan, and there would be no intermediary of health insurance or no need for a bureaucracy like we have for Medicare and Medicaid. The whole business would be between the patient and the doctor, or the patient and the hospital. Today, many businesses are on the verge of bankruptcy because of the excessive costs of providing insurance for health care for their employees, and many of the businesses are reluctant to hire new employees because of this big expense. Can you imagine the surge in the economy if suddenly the businesses would not have to worry about health insurance or health costs for their workers? They would be able to hire as many as they want with no worry. So I think this has great potential. I've been trying to convince presidents and other political officials to try this out, but for the last 15 years or so I've had to be patient with no response. But I have talked with, to date, 27 different doctors, and every one of them says it's the best plan ever, but they're afraid that it would never be adopted because of the strength of the health insurance companies and the big bureaucracy dealing with Medicare and health care. But if enough people would take an interest in this and maybe get it in front of President Trump, I think it's the kind of an idea that President Trump would like, because it would bring about a surge in the economy and do away with a lot of government jobs. There would be a lot of new jobs, because I think even if foreign visitors here, whenever they bought anything, they would also have an account, and that money would accrue for them. They could never go in the hole, so to speak, like the American citizens could, and they would eventually build their savings back up. But the foreign visitors would be tempted to come back and get some medical care to use the money that they had accumulated in their savings account. Businesses could also pay maybe a 5% tax and use this money for a special fund to perhaps provide a doctor in residence in their company or other healthcare facilities to make it easier for their clients. I think that the surge in the economy and the ease in being able to get good health care would make this plan by far better than any other plan that's been proposed. People who today are reluctant to go to the doctor because maybe they don't have insurance, or they just are afraid to use that up, and other people that go too frequently because their insurance is so good about paying anything they want, and they get excess MRIs and other expensive tests. But this way, people would be spending their own money that's in their own savings plan, and there would be no reason for them to put off a visit to the doctor, but there would be no reason for them to go and get excessive treatment. And my plan is that at perhaps age 70, the people would be able to withdraw money from this savings account, much as 401ks are withdrawn today. And if they died, this would be their estate. So it has a lot of good attributes, and I hope that you'll give some consideration to this. I'd be glad to hear from you. As usual, you could get in touch with me at cconger6@gmail.com. That's cconger6@gmail.com. Glad to hear from you if you have a suggestion on how I might push this forward. Thanks for listening.